Heard of ADHD before or are just learning about it, this video will provide you with a deep understanding of what it is, how it affects people, and what you can do if you or someone you know might have ADHD. ADHD is more than just being easily distracted or hyperactive. It's a complex condition that can impact various aspects of life. But with the right knowledge and strategies, it's possible to manage ADHD effectively and live a fulfilling life. Let's dive right in. Section 1. What is ADHD? ADHD is a neurodevelopmental disorder that affects how the brain functions. People with ADHD often struggle with attention, hyperactivity, and impulsivity. These symptoms can vary in intensity and can affect people differently, making ADHD a unique experience for everyone who has it. There are three main types of ADHD. First, we have the inattentive type. People with this type of ADHD often have trouble focusing, paying attention to details, and following through on tasks. They might seem forgetful, disorganized, or easily distracted. For example, someone with inattentive ADHD might start a project with good intentions, but quickly lose interest or forget important steps. Next, we have the hyperactive impulsive type. This type is characterized by high energy levels and impulsive actions. People with hyperactive impulsive ADHD might feel the need to be constantly moving, talking, or doing something. They may act without thinking, interrupt others, or have trouble sitting still, even in situations where it's expected, like during meetings or classes. Finally, there's the combined type, which is the most common. People with combined ADHD experience symptoms of both inattention and hyperactivity impulsivity. They might struggle with staying focused on tasks while also feeling restless or impulsive. ADHD is usually diagnosed in childhood, but it can continue into adulthood. In fact, many adults live with ADHD without even realizing it, attributing their challenges to stress, personality quirks, or other factors. Section 2. How ADHD affects daily life. Living with ADHD can present unique challenges, especially in environments that require sustained attention and self-regulation. Let's talk about how ADHD can impact daily life, both in childhood and adulthood. For children with ADHD, school can be particularly difficult. They may have trouble paying attention in class, completing homework, or following instructions. This can lead to frustration for both the child and their teachers, as the child might be labeled as lazy or disruptive when, in reality, they're struggling with symptoms of ADHD. Social interactions can also be challenging for children with ADHD. They might have difficulty taking turns, listening to others, or controlling their emotions. This can make it hard to form and maintain friendships, leading to feelings of isolation or low self-esteem. As children with ADHD grow into adults, the challenges can shift but often remain significant. In the workplace, adults with ADHD might find it difficult to stay organized, meet deadlines, or manage their time effectively. They might switch jobs frequently or struggle to advance in their careers due to difficulties with focus and follow-through. In personal relationships, ADHD can also have an impact. Adults with ADHD might be perceived as unreliable or inattentive by their partners, leading to misunderstandings or conflict. Managing household responsibilities, such as paying bills on time or keeping track of appointments, can also be more challenging. However, it's important to note that ADHD doesn't only bring challenges. Many people with ADHD are highly creative, energetic, and capable of thinking outside the box. With the right strategies and support, individuals with ADHD can leverage their unique strengths to achieve their goals and lead successful lives. Section 3. Recognizing the signs of ADHD. Recognizing the signs of ADHD is crucial for seeking the right support and treatment. ADHD is often misunderstood, and its symptoms can be mistaken for other issues, such as anxiety, depression, or even just a lack of motivation. So, what are the signs of ADHD? Let's break them down into the three main categories: inattention, hyperactivity, and impulsivity. Starting with inattention, here are some common signs: difficulty paying attention to details or making careless mistakes. trouble staying focused on tasks or activities, especially if they are not immediately rewarding or stimulating, frequently losing things like keys, wallets, or important documents, struggling to follow instructions or complete tasks, even when they are understood, being easily distracted by external stimuli, such as noises or movements, forgetfulness in daily activities, such as forgetting appointments or tasks. Now let's talk about hyperactivity. Common signs include fidgeting or tapping hands or feet, or squirming in seats, difficulty staying seated in situations where it is expected, such as in meetings or at the dinner table, feeling restless or constantly on the go, as if driven by a motor, talking excessively, sometimes interrupting others or finishing their sentences, difficulty engaging in quiet, leisurely activities. Lastly, impulsivity can manifest in the following ways: acting without thinking, such as making impulsive decisions or purchases, interrupting others during conversations or blurting out answers before questions are completed, difficulty waiting for one's turn in activities or lines, engaging in risky behaviors without considering the consequences. If you recognize several of these signs in yourself or someone you know, it might be worth exploring the possibility of ADHD. However, only a healthcare professional can provide a proper diagnosis, so it's important to seek help if you suspect ADHD. Section 4. Seeking help and managing ADHD. If you or someone you know is experiencing symptoms of ADHD, it's important to seek help. Early intervention can make a significant difference in managing symptoms and improving quality of life. Many successful individuals, including celebrities like Michael Phelps, Simone Biles, Justin Timberlake, Adam Levine, and Will Smith, have been open about their experiences with ADHD, proving that with the right support, it's possible to thrive. The first step is to consult a healthcare provider, such as a psychiatrist, psychologist, or primary care doctor. They can evaluate your symptoms, discuss your medical history, and determine whether ADHD might be the cause of your challenges. This evaluation might involve questionnaires, interviews, and possibly some psychological tests. Once diagnosed, there are several treatment options available for ADHD. These often include a combination of medication, therapy, and lifestyle changes. Just like Simone Biles, who has found ways to channel her focus and energy into becoming one of the greatest athletes in the world, you too can find a treatment plan that works best for you. Medication is commonly prescribed for ADHD and can help manage symptoms by improving focus, reducing hyperactivity, and controlling impulsive behaviors. There are different types of medications available, including stimulants and non-stimulants. Your healthcare provider will work with you to find the right medication and dosage that works best for your needs. Adam Levine, the lead singer of Maroon 5, has spoken about how medication has helped him manage his symptoms and stay on top of his busy schedule. Therapy is another important component of ADHD treatment. Cognitive behavioral therapy, CBT, is particularly effective for individuals with ADHD. CBT helps you develop practical skills for managing your symptoms, such as organizing your tasks, improving time management, and reducing procrastination. Therapy can also address any emotional or psychological challenges that might arise from living with ADHD, such as anxiety, depression, or low self-esteem. Justin Timberlake, who has also opened up about his ADHD, has found success by staying organized and managing his time effectively. In addition to medication and therapy, lifestyle changes can play a significant role in managing ADHD. Here are some strategies that can help. Create a structured routine. Having a consistent daily routine can help you stay organized and manage your time effectively. Break down tasks into smaller, manageable steps and use tools like planners, calendars, or apps to keep track of your responsibilities. Michael Phelps, the Olympic swimming champion, has used structure and discipline in his daily routine to help manage his ADHD and achieve incredible success. Prioritize tasks. Focus on completing the most important tasks first and avoid multitasking, which can make it harder to stay focused. Breaking tasks into smaller parts can also help you avoid feeling overwhelmed. Reduce distractions. Identify the things that distract you the most, such as noise, clutter, or technology, and find ways to minimize them. For example, you could use noise-canceling headphones, declutter your workspace, or limit your use of social media. Practice mindfulness. Mindfulness techniques, such as meditation, deep breathing, or yoga, can help you stay present and focused. These practices can also reduce stress and improve your overall well-being. Will Smith, another celebrity with ADHD, has credited mindfulness and staying present as key factors in his personal and professional success. Stay active. Regular physical activity has been shown to improve focus, reduce hyperactivity, and enhance mood. Aim for at least 30 minutes of exercise most days of the week. Get enough sleep. Sleep is essential for managing ADHD symptoms. Aim for 7 to 9 hours of quality sleep each night and establish a bedtime routine to help you wind down and relax. Seek support. Don't hesitate to reach out for support from friends, family, or support groups. Having a strong support system can make it easier to cope with the challenges of ADHD. Celebrities like those mentioned have often spoken about the importance of support systems in their lives. By seeking help and making these lifestyle changes, you can effectively manage ADHD and achieve your goals, just as these well-known figures have. Remember, ADHD is just one part of who you are, and with the right support, you can lead a fulfilling and successful life. Section 5. Living with ADHD. Living with ADHD is a journey that requires patience, understanding, and self-compassion. It's important to remember that ADHD is not a flaw or a failure, but rather a different way of experiencing the world. With the right strategies and support, individuals with ADHD can thrive and achieve their goals. One of the most important things to keep in mind is to be kind to yourself. ADHD can be frustrating, but it's important to recognize your strengths and celebrate your successes, no matter how small. Everyone has their own unique challenges, and ADHD is just one aspect of who you are. It's also important to educate yourself about ADHD and to advocate for your needs. Understanding your condition can help you communicate more effectively with others, whether it's with your employer, teachers, or loved ones. Don't be afraid to ask for accommodations or adjustments that can help you succeed. Lastly, remember that you are not alone. Many people with ADHD go on to achieve great things, and there are countless resources available to support you on your journey. Whether it's through therapy, support groups, or online communities, you can find the help you need to manage your symptoms and live a fulfilling life. Conclusion: ADHD is a complex condition that can affect various aspects of life, but with the right knowledge and strategies, it's possible to manage it effectively. By recognizing the signs of ADHD, seeking professional help, and making practical lifestyle changes, you can take control of your symptoms and live a successful and fulfilling life. Thank you for watching this video.